Myself, Dr. Pankaj Mazumder, Senior Resident Jennings Info. Today I am going to discuss something regarding knee osteoarthritis. Osteoarthritis is the most common form of arthritis and knee is the most common joint to involve in osteoarthritis. Now, what is osteoarthritis? Why it's happened? What are the risk factors? What are the clinical features? What to do? What not to do? And some investigation and different modalities of treatment we are going to tell you. First of all, we have to know what is osteoarthritis. It's mainly a degenerative joint disease that occurs when the flexible protective tissues at the end of bone, which is popularly known as cartilage tissue, it wears down, occurs gradually and worsens over time. It occurs typically the results of wear and tear in the progressive loss of articular cartilage. The intensity of the clinical symptoms of osteoarthritis it's vary from individual. Even the rate of progression also it's vary. And now, what are the types of osteoarthritis? There is two types. One is primary, one is secondary. What are the causes of primary? What are the causes of secondary? I am telling you. Primary osteoarthritis, we found our day-to-day practice most commonly. And primary osteoarthritis is the articular degeneration without any underlying reason. But the secondary osteoarthritis, there is some reason. Is the consequence of any post-trauma case or any abnormal articular cartilage. What are the risk factor of osteoarthritis? There are some modifiable risk factor and some non-modifiable risk factor. Under the modifiable risk factor, most commonly is associated with obesity and the occupation, any trauma or muscle weakness and imbalance or any repetitive stress on the joint. In non-modifiable risk factor, there is female. Those are most commonly affected. In the age, more than 40 years, and some metabolic disease, any bone defect, and the family history. Last but not the least, there is some genetic factor also involved. It is the mainly the imbalance between cartilage worn down and chondrocyte repairing. Now, what are the clinical symptoms of this osteoarthritis? Common clinical symptoms include knee pain that is gradual and it leads to disability. It occurs with activity, knee stiffness, and it's cause difficult to walk and stair climbing, and pain after prolonged sitting or resting. It's also associated with decreased range of motion, creaking and grating sensation over the knee, locked knee, sometimes the redness, swelling of the knee, and sometimes knee gait abnormalities. Now, what to do if you suspect or you find any problem which I mentioned earlier? Immediate consult your nearby ortho doctor, and lifestyle modification which include rest, weight reduction, muscle strengthening exercise, and hot and cold fermentation depends on your knee condition. Most important things, what not to do. Applying your Google knowledge, it will harm more than your disease. And avoid seeking medical care. Now in our country, most of the patients they never come during the beginning of their disease. When its disease progression is severe, then they used to come for any medical advice. And those are high impact exercise you have to avoid, like running, jumping, and exercise. Those put lot of stress on your knee, like deep squat, lunges. This you have to avoid. And other thing that those are long duration sitting. Till now, you have understood what is osteoarthritis and what are the cause, what are the risk factor, what to do, what are the symptoms, what not to do. When any patient come to us for taking any medical advice regarding knee osteoarthritis issue, that time what we are doing, I will tell you in my next video regarding the clinical examination, what are the investigation, what are the grades of osteoarthritis, and the all type of treatment modalities depending on your grade. Till then, take care. Bye bye.